Everybody knows that it is a time of pandemic. Corona is in our thoughts, Corona is our reality. We are all very worried. Things are uncertain, things are static, and things are changing very fast. So it is obvious that not only are adults affected by this situation, but young people are affected by it as well. It is the hardest time to be a parent at this point of time. Let's look at a few strategies that will help, a few principles that will help us be good enough parents. We do not need to be the best parents on earth. We need to be good enough parents. Then, we all want our children to listen to us. But we haven't really worked hard enough to earn this right to be heard. You know, the first word that a child learns, and that's even going to be more valid at this point of time, is the child learns how to say no. Even a 6-month-old child refuses to do something if they don't want to. So, trying to get over this oppositional nature of another human being, the best strategy for that is earn the right to be heard. So how do you earn the right to be heard? First, you value each child as a child. Every child is different. There's diversity of abilities in them. Focus on their abilities, not on their limitations. Do not compare children. Second is to respect children. Even very, very small children have a need for their own space, have a need to do things that they want to do in their own way. Make sure that they are safe, make the environment safe, and then stop saying no. As I said, listen to them when they're talking. Do not question their feelings. Do not question their thoughts. Why are you worried? Why are you feeling like this? Why are you not doing this? Why is a very difficult question for anybody to answer. If I were to ask you, why are you watching this video? Why have you had a bath today? Why are you washing your hands? You would first feel affronted, and then you would feel slightly defensive, and then you would not want to talk to me. Similarly, when you're talking to children, stop asking why. Be with them. Make statements about what you are feeling, what you're going through. Show your affection, show your feelings. Then it's extremely important to inform children. Now, unless you've earned your right to be heard, how would you inform them about the difficult situation of coronavirus? Even if you have to ask them to wash hands and not touch their face with their hands, or not go out into the park, even if you have to put in all these rules into place, how would you do that unless you have a basic level of communication with them? And the basic level of communication will only come not by telling them what to do, but by listening to them. Lastly, it's a difficult time. You have to discipline. There can be challenging behavior. Do not generalize when you discipline. Discipline with love. Disciplining is not about teaching a lesson. Disciplining is about creating a safe space so that the children can learn for themselves. Disciplining is not about getting your way. Disciplining is about teaching the child to negotiate and manage conflicts. If there is one skill that you can teach your children during this time, it is to be able to negotiate and manage conflicts, because they're going to face a significant number of issues that they have to negotiate with. I also want to salute the people who are surviving this situation in our world, this situation in our lives. through very, very, very hard efforts. So I don't think there are 10 steps to an easy life that any psychiatrist can tell you or anybody can tell you right now. My thoughts are with you. I hope that all of us are going to come on the other side and learn from this experience. But it's going to be a difficult experience. And accepting that we are all anxious and we are all going through a tough time, especially our children, accepting that and then starting to work on it is a much better way of saying nothing's happening and we are going to have business as usual. Please do take care of yourselves and your children. Be with each other. Thank you very much.